Now, when you design the treatment for the particular individuals, you would look for the comorbids. What is the clinical condition that the patient is suffering from? For instance, in case of Gracie, she was suffering from infectious mononucleosis. So you would be treating that particular underlying condition first of all. And according to that, you would be managing the particular cases. For instance, people can also suffer from hypothyroidism. They can suffer from renal diseases. They can suffer from depression. They can suffer from panic attacks. They can suffer from bipolar disorders. So depending upon the underlying condition that the patient is suffering from, you would be managing or treating the patients accordingly. But the specific treatments that we usually allow for the patients of this CFS, that is the chronic fatigue syndrome, would be the cognitive behavioral therapy. And as I've already mentioned, PACE was a research study that was conducted, and it basically showed that almost 59% of the patients showed improvement after cognitive behavioral therapy. Almost 51% of the patients showed improvement after graded exercising techniques. So this was one of the phenomena that was seen in the patients. But later on, even this study was challenged, and it was basically thought that it was a biased study, and the results were quite biased because the achievements were quite easy, and again the criteria was too easy, and due to the data that was collected on self-reporting. So these two phenomena basically resulted in a biased study. And that is why even these research studies were challenged later on by the patients themselves, because they really reported that even the cognitive behavioral therapy wasn't proving to improve the condition overall. So we have to basically couple up the cognitive behavioral therapy along with the support that we're going to give to the patient. The supportive treatment, for instance, the underlying conditions are going to be treated as well. And along with that, we are going to even devise these particular graded exercising therapies to the patient. So even this graded exercising therapies under the supervision of a physiotherapist, because even an intensive exercise, if it is not really looked upon, it can cause the fatigue syndrome to even deteriorate in the individual. So you have to really conduct these exercises under the supervision of a physiotherapist, and sometimes they have proven to improve the condition of the patient all in all. So this is how you basically move about and manage the patient. Again, I would like to mention and emphasize the fact that social support is very important for these individuals. Because as we went through the causative factors, psychological aspect was present in the development of this condition. Childhood trauma was one of the key factors. So if we pinpoint these factors and if we try to deal in with the psychological aspects as well, the final improvement in the individuals would be seen, and it would be a better prognostic criteria for the patients of chronic fatigue syndrome or myalgic encephalomyelitis.